Welcome to the office. Hi, Casey.
Hi, Dr. Rahim.
Welcome back. So this is our visit number 3.
Yep.
Okay, you came in with quite a few things. Tell me where you're at today.
I am at probably, I feel like 50% better.
Okay, 50% better for what?
Honestly, like everything, but mainly I'm not feeling the pains, like shooting pains, no shooting pains.
Anywhere in the body?
No
Really?
shooting pain.
Okay.
This whole time I've been able to breathe better and
Okay.
like just talk better. My eyes aren't hurting as much. Like literally all the symptoms have went down like
What do you
significantly.
What do you attribute that to? Because you've had adjustments, you've had a lot of stuff work done on you.
Yep.
What's the Gonstead difference?
The Gonstead difference, I'd
For
say,
you.
Yeah, I'd say the fact that it's holding
Okay.
more. Like usually when I get an adjustment, it would be once I get out of the car going back home, I can feel it kind of just pretty much gone.
Okay.
2-3 days after you did your adjustments and everything, I felt like the adjustment was holding. Like it was holding the whole time.
So the Gonstead difference is things are for you or things are holding
They're
better.
holding better. It's longer results.
Okay.
Yeah.
All right.
I mean, I'm excited.
Awesome.
Just today was the only day I started feeling some more just regular pain and
Upper back?
tension, upper back,
Okay.
neck.
Okay. And you're clear on what we're doing. This is all based on your foundation.
Yep. On the
Right?
sacrum.
On the sacrum.
Sacred sacrum.
You ready?
Yes, sir.
Let's do it.
Let's go.
Let's go. Starting at the base of the neck. We're getting 8 and 9 points. C1, left side. 10 points. That's C1 or maybe even C2. We'll take a look. You're doing your walks?
Mm-hmm.
Good. T6, 15 points. Things are shifting around for you, sir. Good. And let's see what we got down low. You mind if I just put these down a little bit?
Oh, yeah.
Thank you. All right. You had a good weekend?
Awesome weekend. Had my brother come over. He flew down from Georgia, and we were just chilling on the beach.
Right on.
Yes.
10 points. S3, S4. We're going to continue on the sacrum. We have the around T6. Let's statically palpate and see what we got. We know we have that rotated sacrum dropped on the right side, correct?
Mm-hmm.
Head down, please. Static palpation. Running our fingers down the spine. The swelling is significantly reduced, but we still have some there. 1, 2, 3, 4, 5, 6, 7 more tender, 6, 6.
7, I think, yeah.
7 is tender as well. Head down, please. 7, 1, 2, 3, 4, 5, 6, 7, 8, 9. Starts at 8. Yes? 7 is tender.
Yep.
6 is tender.
Yep.
But it's starting at 8. Agreed?
Yes.
Let's take a look at the foundation. Scoot forward, please. Feet together. Open and close the knees. Sit up a little bit straighter. Good. Open and close the knees. Open and close. Left side only. So when he does the left, the right does shift with it because of fixation, but it's still less than visit number 1. Right side only, please. When he does the right, there's a little bit of shifting, but not as much. More of a tug from the iliolumbar ligaments or sacral ligaments. Okay, scoot back for me, please. Scoot your bum back. All right. Slowly come back into extension. L5, S1, S2, tender, S3, S4 on the right side. S4, T8, and let's check up top now, up at the neck. Scoot back for me, please.
All right.
And I'm going to grab a little bit of the hair.
Okay.
Just a tiny bit. 7, 6, 5, 4, 3, 2, C2, C1. I'm going to look at the film just to confirm the upper cervical, okay? They're both fixated, C1 and C2.
Okay.
So let me take a look over here and see what we're going to do. Okay. So when we're looking over here at C2, we can actually see C2 is wedged up slightly on that right side. So we're going to set C2 on the right and then C1 on the left. We need to have a stable foundation to set C1, okay? And it's not going to be a hard one. Next thing is 1, 2, 3, 4, 5, 6, 7, 8. T8, we're going to set as a We're going to set it as a PR-T. So T8 as a PR-T. We're going to set C2 on the right in order to get a stable foundation for C1. We call that a critical atlas. So if the bottom is wedged one way and the atlas is wedged the other, if we adjust the atlas without adjusting that C2, it doesn't hold. It comes right back.
Got it.
Make sense?
Makes sense.
Okay.
Got it. Okay.
Let's come over here, please. We're doing it as a PR-T. 1, 2, 3, 4, 5, 6, 7, 8. Casey, you good? Mm-hmm. All right. T8, PR-T, get the tissue out of the way. We're right on the transverse of T8. There it is. We're going to do this two ways. Let's set the transverse. Gotcha. And let's get a spinous. How you doing?
Oh,
A little more.
great.
That's it. Gotcha. Your sacrum will... Let's walk it off. Spicy?
Oh, it's spicy.
Spicy. Walk it off one more time. Okay, and let's go face down over here. Let's bring that out. 1, 2, 3. PR, sacrum, S4. Hold your wrist, please. Nice and easy there. Right through the joint. Gotcha. Home run. Wait for it. Let's go ahead and walk it off.
My eye pain went away.
Just now? Yeah. From a sacrum or from a T8?
From whatever just happened.
Okay. And here's the idea. It wasn't the sacrum, it wasn't the T8, it was just wherever the nerve pressure was that was putting you out of balance.
And that was nerve pinching?
Yes. And that's what we're doing here in the Gonstead work, right? We're finding the pinched nerve, right? Dr. Gonstead used to say, always suspect a neuritis first. So it's due to the misalignment causing inflammation at the joint. And we're using the vertebrae as a bony lever to get the pressure off the disc and hence the nerve. Make sense?
Got it.
Have a seat over here, please. C2. Nice and light PR. Let's control a little bit better. There it is. Gotcha.
That was clean.
And now C1. Soft pinch of the SCM. Get right anterior to the SCM. You're not on the SCM. You're not behind it. You're going to pull that tissue, that SCM out of the way. Get on the tubercle of the atlas. He's flexible, so I got to drop that elbow down. That was a great one. Down. There you go. Just breathe, Casey. Deep breathing. Walk it off once, please. Actually, walk it off twice, okay. And then we'll recheck. Good stuff. Very nice. Come back over here and have a seat, please. Let's re-scope. Make sure we're clear. And we talked about, right, a potential heel lift down the road.
Yep.
We talked about that because you can see his measured difference is 16. That needs to get under 7 for all of this stuff to hold. I think after the next visit, we're going to institute or incorporate a heel lift for you and see how you respond with that, okay? Meaning you'll put it in the bottom, underneath the sole of your shoe on the right side. All your shoes that you wear, you will be using an insert. You'll walk on it for maybe about 10 days, then I'll recheck you.
Okay. And if I'm walking on the beach, do I have like a...
The beach, no, the beach doesn't, but here's the thing. Okay. If down the road we feel that we're gonna need a heel lift more, on a more permanent basis, then we may need to get some flip-flops made.
Okay.
Okay? Okay. I don't know that just yet right now.
Okay.
Okay?
Okay, that sounds, because I'm trying to walk on the beach. Like, that's why I'm also here.
Barefoot, you're fine.
Okay.
Barefoot, you don't need anything.
Cool.
Head down, please. Neck is clear. Mid-back is clear. Oh, yeah. And low back is clear. Let's just do a check. Sit up straight. Sit up straight. Back slowly towards me, all the way back. In extension. There you go.
Wow.
All the way back. Good. All the way back. Excellent. All right, senor. Let's do the shoulders. Drop it down. Shoulder. Stand up for me, please. Check the hands. Squeeze. Hands are good. Squeeze. Squeeze. Tiny bit on the elbow. Come over here, I want to show this elbow. So we have a posterior radial head. And the way we're going to set it is I'm contacting from the underside. This is an alternate contact. I'm right there, and I'm going to be extending the elbow and pushing it straight, P to A. So I'm tractioning the joint by pulling down on the hand or at the wrist, and set. Ooh, nice and clean. Squeeze. There you go. Questions?
Can you over adjust? Like, can I get too
many
adjustments?
Can someone get over adjusted?
Yeah, like if I keep going like my whole life, like, and keep doing this, keep getting adjusted every whatever week, every couple weeks, will that mess me up? Okay,
so here's the answer. The criteria to get an adjustment is we have to have objective findings present. So what does that mean? We're looking at the components of inflammation. Number one is the heat or heat component. So if there's pressure on the meter, restricted range of motion, swelling, tenderness, loss of function, that justifies an adjustment. It's not let me feel something is tight or stuck and let's crack it.
Right.
In the Gonstead work, we're looking at, and that's what I said in the beginning, 4 visits is to figure out your case. And I'm trying to figure out your case with you.
Yeah.
Once we figure out how to stabilize that foundation, the idea is stabilize it. And it's not about coming in every week for the rest of your life, no.
Okay.
It's about keep it stable, number 1. Number 2, what is the activity? What are the restrictions? And what are the limitations that are already present? So if we have a structural short leg on the right and a functional short leg, how much of that can we correct? The second thing is you got a car, right?
Yeah. Oh, well, not right now.
No, but I'm saying, let's look at this like a car.
Oh, okay.
So you're driving to work. You hit a pothole. Your car goes out of alignment. Things wear out unevenly. You go get an alignment fixed. You keep hitting the same pothole.
Right. Right.
So the second part of being here is learning the potholes on your path and readjusting your path. So you're not making those same mistakes, whether that's trauma, whether that's posture, whether that's nutrition, whatever the lifestyle choices that we make. Does that make sense?
Definitely.
So the idea is this: number 1, get it stabilized, get you back in balance, and figure it out. I have patients here that come every couple weeks. I have patients that come once a month. I have patients that come twice a year. I have patients that come every few years. Okay, everyone is different.
Right.
And in your case, as I said, is get the foundation right, and this becomes a lifestyle choice. You get your car tuned. You're mechanical in nature. The human frame is mechanical by nature. Everything mechanical does what? Breaks down and requires some sort of maintenance.
Right.
But the idea is not coming in every week to get adjusted.
Okay.
Okay?
Okay. That sounds good, because that was the whole goal, because I don't want it to be like that either anyways. Like,
Absolutely.
I want to be able to just like be in my bed, not have to go to doctors all the time. But I love this. Like, I want to go here and learn about everything that's happening. I've learned so much just being here. So
Okay. All right, Casey, so we're set for today.
sounds good.
All right, dude?
I'm ready.
All right. We'll see
All
you.
right.
You take care.